Thank you everyone for joining today. Welcome. Good afternoon. You're here to learn about our micro-certificate program called Health Data Analytics, Opportunities and Applications, which has been co-developed by the UBC Department of Medicine and UBC Data Science Institute. So welcome. My name is Steph Chia. I'm the research manager at the Department of Medicine, and our team also joining today. I have Marlene, Jen, Sang-hyun. We all help support this course delivery along with the UBC Extended Learning team. And today you'll have the opportunity to learn from or hear from our program leads and find out why we created this program and what you can expect to learn if you were to join the program. So we will have a lot of time today at the end of our presentation for you to ask any questions that you might have. And we'll be providing you with more details about each of the 3 courses that make up this micro-certificate. We are recording this session and we'll be posting it on our website for future reference. So before we go into our info session presentation, I do want to acknowledge that we are joining today's meeting from UBC in Vancouver, British Columbia, which is located on the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. This is where the Health Data Analytics Micro-certificate was conceptualized and developed. And I want to also acknowledge that you may be joining from various locations and territories across the province or the country, and I want to acknowledge the traditional caretakers of those lands as well. So this is our agenda for today's session. We're just going to start off with some welcome and introductions. Then we'll go over why we developed the program, who this program is targeted for, the curriculum for each of the courses, and some of the goals and benefits and potential career applications you might get from after completing the micro-certificate. And after the presentation, there'll be the Q&A session. So I would like now to introduce to you our program leads, Dr. Anita Palapu and Dr. Raymond Ng, who will be presenting in the session. So first, Dr. Anita Palapu is Professor Eric W. Hamber Chair and the head of the Department of Medicine at University of British Columbia and Providence Healthcare. She is also the co-lead of the Data Science and Health, or DASH, Research Excellence Cluster at UBC. And we have Raymond Ng, is a professor of computer science at the University of British Columbia and the director of the Data Science Institute. He is also the holder of the Canada Research Chair on Data Science and Analytics, and they are also both co-leads of the UBC Faculty of Medicine AI and Health Network. So I would like to now pass it to Anita to provide an overview of our program.
Thanks so much, Steph. So health data analytics is really about making sense of the vast amount of data that we collect in healthcare, and it uses tools from data science like statistical analysis and data mining to uncover the hidden patterns and trends that we may see in patient data. So these insights can be incredibly powerful. They can help clinicians predict outcomes, tailor treatments, and hopefully make more informed decisions at the point of care. So for example, by analyzing historical patient records, we can predict the likelihood of someone being readmitted to hospital or identify those who may be at risk of adverse drug reactions. So this could allow for earlier interventions and better outcomes. So think of it as moving from reactive care to proactive, data-driven decision-making. So let's talk about why we developed this program. So first of all, big data. We developed this program to address the growing volume and diversity of health data. So for example, with Cerner and other electronic health records, we have so many health records and clinical trial data, imaging data, and wearables that we can consider. We also have increasing computational capabilities, and at the same time, we recognize there's increasing amount of computation that is occurring, and it's rapidly increasing. And these improvements in both computing and storage can enable the use of advanced data science and AI tools. We also recognize healthcare professionals lack skills and knowledge to understand and apply these technologies. This has all been changing very rapidly in the last 5 years, and it's only accelerating. So it's important that we have better data literacy. So we built this program to improve this data science literacy and to help healthcare professionals upskill and build foundational knowledge in data science so that they can use the tools responsibly and effectively. So this program is designed for a broad and diverse group of professionals who interact with health data in different ways. So first, it's highly relevant for healthcare professionals, and in that we think of physicians, nurses, operational leaders, allied health staff who want to enhance patient care and operational efficiency through data-informed decisions. Second, this program is also useful for researchers, investigators, postdocs, research coordinators who also work with clinical and health system data and want to sharpen their analytic skills and apply new methodologies in their work. And finally, it's to open to others who may not come from a clinical or research background, but are interested in how data analytics can be applied within healthcare systems. This could apply to policy analysts, IT professionals, and as well as digital health innovators. I'll give some examples. So, for example, those in a clinical operations and administration, you may have been faced with the following challenges. You have plenty of health data, but it's not been analyzed efficiently and hasn't been used for decision making. So, you want to contribute to quality improvement, but lack the skills to interpret data outputs. And you feel pressure to justify resource allocation and outcomes. After the micro-certificate, you will be able to learn to interpret, question, and use analytics outputs, ask better questions, and collaborate more effectively with data scientists, and also learn how data can help with capacity planning, patient flow, resource utilization, and performance measurement. Another example for those who are in research, and you might feel like you have to depend on and outsource expertise from statisticians for exploratory analysis, and you're waiting on long turnaround times to gain data insights. And you also struggle to design studies and leverage large clinical or administrative health data sets. What we hope after the micro-certificate is that you'll be able to learn the basics of health data analytics to design studies that are realistic and better matched to available data, play a more active role on interdisciplinary research teams, and also to be able to interpret the results with greater confidence and clearly explain findings. So we're not going to be, I just want to be clear, we're not going to be teaching you how to code, but we're wanting to give you the data science literacy that you can communicate with people who are more computationally sophisticated. So I'll hand it back to Steph. Thanks.
Yes, and for the next section, I'm going to ask Raymond to present.
Well, thank you, Steph, and thank you, Anita, and then thank you for the people who are joining this session. Let me pick up on what Anita said in terms of the benefits of this program. I think we co-design and co-develop this content with experts and leaders across BC's health sector. So by coming to our program, I think you'll be learning from people who understand the real world challenges you may be facing on the front line of care or in your research setting. The second benefit is that our content is very BC, British Columbia specific. So we particularly show you how to apply data analytics using real-world examples with BC health data sources. And that means that you're gaining really practical insights that are hopefully immediately relevant and applicable in your workplace. There's another benefit is we are, with this program we are trying to create a community of practice, because in this program beyond building up your skills, you are also joining a growing network of like-minded professionals right here in BC. Staff later on is going to tell you that in our courses we have office hours, and we often hear stories that learners learn a lot by coming to this office hours so that they be part of this community. And then you'll be, with the skills that you learn, you will be able to work more effectively, as Anita said, to communicate clearly with other data professionals and contribute meaningfully to the analytics-based decisions. And then finally, there would be career enhancement. You'll be acquiring new health data analytics skills and tools that will help you to enhance your current career. Next slide, please. So one of our main goals in designing this program was to deliver the most current and relevant BC information. And for this, it was critical that we engage and partner with active experts in the field. What you are seeing on the slides are, 10 or more um, organizations within BC, and we're actually very fortunate to have joined in our course by instructors coming from many of these different healthcare organizations in BC, and together they provide a comprehensive picture of where we are at in terms of health data science provincially, and we are and then where we are heading. Next slide, please. Now, let me actually spend maybe 5 minutes at a very high level going through with you how the program is structured in 3 standalone courses. The first course is Introduction to Big Data Era and Opportunities for Better Healthcare. Second course is Health Data and Visualization. And the third course is Health Data Analytics and Machine Learning. So now we're going to go through at a 30,000 foot view of the outline of each course. And so in the first course, focusing in on big data era and opportunities, we first give an overview of BC health data sets and platforms, and the application of data analytics in a healthcare delivery setting. The course uses very specific examples such as AI in computer vision for echocardiography, using natural language processing for patient triaging or monitoring, mental health, ambulance deployment in healthcare operations, and so on. And then for those interested in the clinical aspects, operational aspects, or those in research field, there's also a lot of different paths for everyone. The overarching goal of this first course is to help participants understand how to identify the right data sets and analysis techniques for impactful health data applications. So this is the first course. The second course focus on health data and visualization. And in particular, we want to talk about how to visualize data, how we could tell compelling stories with the data, and then ensure the quality of the data. So for those of you who deal with data on a daily basis, it's important for you to think about how data are processed and cleaned and ultimately stored. This is an important concept now in this era of big data. We will spend in this course a significant amount of time on how data can be explored, especially from a visual perspective, and then also talk about how to present data graphically in a meaningful way. So that we could tell a story that is backed up by data. And so we would talk about data communication skills, principles of study design, how data could be collected to mitigate biases and confounding factors. And we will also touch upon important ethical considerations about collecting, storing, using and presenting data, so I think that would be that is the focus of the second course. So it's very data driven, whereas the first course we talk about data sets, the second course we talk about the data. So in the third course, this is the course where we talk about analyzing the data. This is the course we want to introduce to you more advanced analytics tools, including machine learning. So this course is designed to circumvent. It's important to note that we don't require any basic background skills. There's no need to have programming skills, for example, and the course is designed to allow people to be able to learn with this piece of software that's called Weka. It's an open source program, and the idea is that then even though you might not be doing computer program directly, you will still be able to learn the concepts uh, with Weka. The course will also touch a little bit on natural language processing, which is a branch of AI that uses machine learning and linguistics, computational linguistics concept to allow computers to understand and communicate with, using human language. For those of you in the healthcare system, you know that a lot of our data is actually really stored in clinical documents, and the clinical documents are written in plain, English, or French, and so the use of NLP to try to allow us to extract important information from clinical documents is a very important uh, um, area when it comes to the applications of AI and machine learning in healthcare. So together, the three courses are really trying to provide a strong foundation for the learners to be able to understand just a little bit about health data science, learn some practical skills that may be applicable in the healthcare domain that you are in. Now, before I finish, I want to follow up on what Anita said in one of her earlier slides when she discussed what this program is designed for. Since I have already given you an overview of the three courses, I also want to just talk about what this course is not uh, intended to be. Um, the idea, we are not saying that so it's important to note that we are not claiming in any way that after you take this course, you will become a health data scientist. Um, but what we are saying is that with this program, we will provide you with the knowledge and the skills, and you'll have a solid understanding of data analytics fundamentals. You learn how to apply the skills in your day-to-day work. You want to enhance your ability to collaborate effectively with data science and analytics professionals. And our objective in developing this program is really more from the point of view of basic literacy of it. Now, for some of you, if you after you like what you are learning from our program and you want to go deeper, you want to pivot and actually become a health data scientist, there are other programs uh, uh, in UBC, for example, that would help you with that. So very much so, this particular micro-credential program is really just an entry point, providing the basic skills, basic literacy when it comes to data science, AI and machine learning. So with that, I'm going to pass back to Steph, and I'll be very happy to answer your questions regarding the curriculum and other aspects of it during our Q&A. Thank you.
Raymond. Okay, so the next few slides are just going to go over some of the more details about how the program runs. So it's part-time, 100% online. The program materials are made up of asynchronous lectures. We also have online assignments and discussion boards. We expect that the workload is around 5 to 6 hours per week. And we also hold synchronous Zoom office hours, which takes place in the evening. This is a chance for the students in the class to speak with our course facilitator or instructor, questions about what they learned during the week's module content, or maybe questions about the assignment. And I think Raymond kind of mentioned it's also a good chance to kind of ask some more applicable questions if you want to learn more about what's happening in the healthcare field right now. So the Zoom office hours are optional, but we do like the students gain a lot of they get a lot from the deeper discussions that can happen during the office hours. Okay, so each course, there's 3 courses. Each of them are kind of run on the same schedule, so they're each 5 weeks long. So if you were to take all 3, we expect it to take around 90 hours total. The tuition for the course is $9.95 per course and $29.85 for the entire micro-certificate program. For assessments, which are based on the quiz, self-check quizzes and assignments, you must achieve a 70% to pass. And the introduction to the big data era starts on May 26th. And then the next 2 courses kind of happen sequentially. So you could take all of them back to back if you wanted to. We are also looking at offering another group of the micro-certificate courses starting in September. That will probably be confirmed later in the summertime. So you can earn a UBC micro-certificate in just 4 months. Okay, so that takes us to the end of our info session presentation time. And I've shared the Slido QR code again and the link. So hopefully people have been able to navigate there to ask their questions. And so I'll stop screen sharing and then we'll put up the Slido questions for Anita and Raymond to take a look at them.
So Steph, could I quickly add one comment to your last slide? In
Mhm.
the way that we design the 3 courses, there's no prerequisite structure. So you could take course 3 without taking course 1 and 2, and then maybe after that you say, well, in a different offering, you could go back and then take course 1 and course 2. So there's no particular order that we require you to go through, even though the 3 courses as staff presented it in the upcoming offering, it's looks like it's actually very sequential, but the content itself is not. So I just want to
Yes,
emphasize that.
yes,
So
that's right. Sorry, I forgot. They are standalone courses. Yeah. Okay, so should we share the Slido questions? Is the degree accredited for academic purposes? Also, is the tuition valid for claims for tax purposes? I'm not sure what the accreditation part means, I guess, for the degree. It's not a degree that you'll be receiving. You receive a UBC Micro-certificate. So I hope that answers. And the tuition valid for claims for tax purposes. I don't know if I have the answer to that either. So it might have to be something we look up with the tax. Tuition is valid for tax. Thank you, Dia. Great.
Um, so, Steph, I think that maybe some people are alluding to the fact that in previous offerings we have the government grant for some people. So maybe you want to talk a little bit about that.
Yes, well, I think that this question was that in your tax return you might be able to claim this tuition fee for some tax benefits. But there is also a government grant that from the BC government called the Future Skills Grant that our program last year was was eligible for, where BC residents are able to apply for a future skills grant, and then that grant can be covered for our tuition. We don't know yet if our program is eligible this coming year, but we will advertise that if we are getting that future skills grant. Okay, so top question is, I am a health information management professional working as a clinical coding specialist. Would this program be the right fit for a health data analyst role?
Steph, maybe I could
Yeah,
uh,
thanks, Raymond.
share my thoughts. As I outlined in the highlight of the cost 1 and cost 2 and cost 3, uh, to my understanding, as a clinical coding specialist, I think I would almost say that I think the Definitely course one is more about data set, about a almost like environmental scan about the kind of health data sources that we have. And I think that that would be very interesting because I think a lot of people in the healthcare setting actually does not know that. And then, as I mentioned, the second course is about the data itself. There's a lot of visualization, and so that might be of benefit to you. And then the third course is an introduction to machine learning. So I imagine that that would be, skills that could be new to you. So I think um, you could decide which one or whether all of the three courses are useful material or new skills for you. So
Okay. Um, the top question right now is what are the programming languages used in this course? I think that would only apply for course three, the health data analytics and machine learning. And technically, I don't think we use a programming language that uses Weka, but Raymond, confirm.
Oh, so I mean, there's no programming language. We are not asking people to write code. This is not uh, how we design this course. We use this package that's called Weka, which is very easy to use. Point and click kind of system that allow you to play with, experiment with various concepts in machine learning. So it's very visual based. Is not there's no programming involved in all three of our courses, and it's actually by design.
Mhm. Okay, so this top question now is, would this program be a good fit for someone who is considering graduate education in epidemiology or biostatistics? Considering to take more graduate education, I guess, is my interpretation. Anita?
I think if you want to do graduate education in epi and bio, you should do graduate education in epi and bio. I think this is a much more practical kind of approach to people who are already having some and want to do more and like understand the data science in the health sphere, or who are health professionals trying to build their data science literacy.
I would also want to add that I think there is an earlier question. The three courses actually is really not that focused on biostatistics.
Mhm.
It is, as I mentioned, course one is about different types of data sets and then the data themselves. And I don't think even in a standard statistical curriculum there's a lot of focus into data visualization and storytelling skills like that. And then I think the machine learning, it just depends on the statistics program. But I think the classical biostatistics is actually quite different from machine learning. And so I agree with Anita that in a way the three courses are actually not that overlapping with epidemiology and biostatistics.
Okay. Okay, this top question, I think, Raymond, you already answered, but maybe we can just highlight again. Would this certificate help get a skill that would one needs to become a health data analyst if someone wants to work in that field? Uh,
Oh, absolutely. I think, data visualization, storytelling, these are very generic, very general skills. And then, the concepts of basic machine learning methods. I think it's something that you'll be able to learn, and through Weka, you'll gain an understanding of what those tools are supposed to be doing. And so I think it is a skill, as Anita said, along those lines. If you are not doing the health data analysis yourself, it definitely help you to be communicating well with the data science professionals.
So this is a question about registration deadlines. Are there any different registration deadlines for the 3 courses, or is it just before each date? And Nay has answered the question in the chat here, I believe. Oh, sorry, she's sending it to me. So regarding, there's no specific deadline, but you can, when you go to the course webpage, you can see when the course deadline is before or so you need to register before the course start. Sorry. But there are sometimes we do have limited seats, so we will have a cap on seats if it gets closer to the course start day, we might close registration. So next question here, given my BS in economics and 20 years as a data and finance analyst, would you recommend this certification for entering health sciences? That's a good question. And yes, I believe we would, I don't know if Anita or Raymond want to jump in there.
Yeah,
Someone who's not
I
from health.
think Yeah, I think if you're not in health, this would give you a good overview of our health data that we have in the province, and it would be much more context domain specific to health. And you probably already come with a number of skill sets, and you could see how those things could be applied. And the data visualization, as Raymond mentioned, I think would be helpful illustrations, and then the application of machine learning as well.
And I think just the domain or the sector of finance and maybe banking is very different from health.
Hmm.
Just the data types are different, and then as I mentioned, there really is a lot of data that are in the clinical documents. So you have what we have a lot of unstructured data, and now in this program we will give you some introduction about it, but there is actually a different micro certificate, a second micro certificate program that this team offers, and that really focus on that unstructured content. But I'm just saying that the finance and the health, I think just in terms of the kinds of data that you collect, are actually quite different. And I would say that if you have been to a hospital, I would actually say that the health data in general is a lot messier than the financial data.
I know that our program, we have such a wide variety of health examples that we use when teaching. So I think that would be really good for somebody who doesn't have that health knowledge yet.
Right.
So this question is, do we have to commit to the micro-certificate when we enroll? If we take individual course, are we still eligible for the certificate when we finish 3 courses? Yes. Yeah, so you don't need to commit to all 3 courses. You just can enroll one at a time. And when you actually complete all 3, you let the UBC Extended Learning team know that you've completed and passed all 3, and they will issue the micro-certificate. So it can be over time. It doesn't have to be all in the one back-to-back offerings. You can kind of like space it out if you'd like to, but so that's a good flexible option. This question is also really good. I work in the leadership team of a large clinical lab in the Lower Mainland. In your opinion, would this course be valuable? I guess just based on our understanding from working on a leadership team of a large clinical lab, I assume that they have a lot of clinical health data they're collecting and maybe need to analyze. So I think if that's the context of what this person is working in, I do think there would be benefits from the course that would be valuable. And does Anita or Raymond have any other?
Yeah, I think so. If you think about large data, like certainly the visualization and then the machine learning, and what are the potential approaches that one could be using, especially if you already have data. Yeah.
Mm-hmm. So in our HIM, the Health Information Management, Data and Analytics Department, they tend to require SQL and to pull ICD-10, CA or CCI health record data and Tableau for presentation. Are these taught?
So I would say that no, because we are not dealing at that level of the curriculum. We assume that the right data have been pulled, and you're not directly, getting into writing SQL, And then I mean we do have a general I mean we have the second course that focus on visualization and the analytics, and Tableau is just one of the software, one of the common platform that people use. So I think the discussions about visual analytics is actually had at a more general level. Um, uh, but this is course two, and so in answering your question, course one is not about SQL, and then course three is also not about SQL, and so.
I was just going to add in course two, we do have a module who's taught by someone who's at VCH who goes over the development of dashboards and, you know, mentions, as Raymond did, that Tableau is one of the ways one can do it, but uses one that's not proprietary to illustrate it. And so those concepts are there, but we're not using those specific proprietary tools in this because of access.
Yes, they'll be using Google Looker Studio, where you can get it with a free account. And we were worried about people being able to access Tableau or Power BI, which usually requires a subscription. Okay, I think this is also a good question. What foundational knowledge is required for this program? Is any lower level coursework in data analysis or computer science recommended or required? There's no requirements, and I don't think we haven't even recommended anything either. So we tried to kind of make this as accessible as possible. If anyone, Raymond or Anita, want to jump, any
Nope.
additions?
No,
Yeah.
I
So
think,
it's
yeah, I think it's actually by design that there's really no prerequisite in computer science and math or in statistics, for that reason.
mhm. Okay. I can ask this question at the top here. Will I be able to use the methods or techniques from these courses in my day-to-day work, given my limited access to data analysis tools as I work with EMR data? Mm,
I mean, I could come back to a similar answer. Visualization in course two is something that's very general, and then the general concepts of in in course three about machine learning, we do things like clustering and then classification. Those are again very general concepts. So when you have a data set and you will be able to if not, I think you'll be able to use Weka uh, to to produce some results for yourself when you have that data. And then if you want to go further, then at least you'll be able to understand what clustering means, what a decision tree means.
mhm. Thanks. Okay. So this question we kind of touched upon by somebody else, but I think it is about the biostatistics. If they already have knowledge in biostatistics, we kind of touched upon how our courses are different. There's not necessarily overlapping with biostatistics
No.
education, um, because the course one kind of gives you an overview of like the BC data sets, and it's a different view of how healthcare data is kind of where it is in the province and how it can be used in, and then the for course one anyway, right? And so I don't believe it overlaps too much. So recommend, I think, yeah. I mean, I think I would recommend the students to kind of go to the course page 2 to kind of read more about each course and some of the learning objectives from it. So to see if there is if there are things there that they haven't learned yet. Okay, so this is the next question is a little bit kind of maybe a follow-up from if you're an HIM student and your goal is to become a data analyst, they're going to be taking our health data analytics course or micro-certificate. So how can they maximize what they've learned, what they will be learning?
Well, I mean, it's hard to be very concrete if you're going to take these three courses, and one obvious way you want to maximize it is you pass all three of them and you get a micro credential certificate. But let me say a few words because I alluded to that in my comments earlier, that imagine that you really like what you have learned from this program. What are the ways that you could then go further and then earn actually kind of like the professional qualification to be a health data analyst or health data scientist? One way is to consider the UBC Masters of Data Science program, so MDS, which is a professional master's degree. And I think that when you graduate from that program, then you will then you are being trained as a professional data scientist. When you graduate from this program, you are not you will not be considered as professionally a health data scientist. But the idea is that you have the basic foundation for it, and you know the concept. You are literate about the health data science, data sources and the challenges and the issues, and then you'll be able to communicate very well when you're working directly with health data scientists. So I hope that answer what you're looking for in the question.
Yeah, I think to be a data scientist, you usually do like a master's or a PhD, and then you have like a lot of training, many years of training. Although those may not necessarily be in the health sphere. So this is kind of like a good taste of what the health um, environment would be like. Um, okay. Is there an advantage of earning the certificate after finishing the three courses, I guess is what they mean? And does it matter or doesn't matter and can take the courses separately as needed? Is there advantage to do all three? Well, you'll get the micro certificate if you do all three, and I guess that you'll get the badge, the digital badge that can be recognized. That is recognized, I guess, through our partners who we've co-developed the program with from the health authorities. I think and when I say recognize, like they understand like what the program is about, what was covered and the purpose of the program. Um, you can't, as kind of Raymond mentioned, you can't say like you're a health data scientist after taking the micro certificate, but you have that foundational education after doing all three. Okay, so this question is about the data that we'll be looking at in Excel or CSV format. Um, I know there will be some, yes. I can't remember if there's other formats that of the data for the assignments, possibly. Like, Raymond, do you remember?
Yeah, I think I don't the what I could say is that in this course, uh, because there's no prerequisite, the data that we are using in our tutorials, in the assignments, are simplified. So, so in that sense, that is easier to describe the data in an Excel, in a spreadsheet kind of format, rather than talking about a relational database. One of the earlier questions asking about SQL. So it won't be, and it will be one simple spreadsheet. And I don't think we are even talking about joining, different, spreadsheets, because that's really not the focus of the program. So.
This question's kind of great about employment success rate for students and which companies usually hire graduates. I don't have this data with us right now, but we do send out a post completion survey to graduates of the micro certificate, like 6 months to 12 months after they've completed the program. We didn't get very good uptake on the survey results, so we have to send some reminders. But I think if when we have this information, we'll be happy to share that. We're still collecting that after this program was first started January 2024. So we should try to collect some of this success rate employment information for you.
Yeah, so I would add that I mean want to emphasize that this particular program is not trying to allow people to become a professional health data scientist. So that's not the goal. And but then I also want to say that if one day you want to be a professional health data scientist, uh, you don't actually need to have a computer science degree. And in fact, the I mentioned about the professional masters, degree program at UBC, the Masters of Data Science. Uh, that program is actually designed for people whose first degree is not in computer science, math, or any other STEM field. So I'm just you know making this comment to say that data science, as a data scientist, as a data analyst, in general, there's no requirement that you need to earn a computer science degree.
Thank you. We're getting close to the end of the hour, so maybe we'll wrap up with a couple more questions. But if you still have questions, you can email info.exl@ubc.ca, and we'll be happy to send that. Maybe we can take this question here about the program being eligible for the Stronger BC Future Skills Grant. This is the grant that I mentioned earlier. Right now, the next offering of our program does not have the Future Skills Grant eligibility. We won't know until the summertime, and then it won't be until the late 2026 or 2027 offerings where it might be eligible. So we will stay tuned about that. Okay. Okay, I think those are some specific questions that maybe we won't need to touch, but I think it's just about you can take the courses in any order that you'd like. So they don't need to be taken in a specific order. Are there any other questions, Raymond, or Anita, you wanted to jump in and answer before we wrap up our session today?
Not from me, but as I mentioned, thank you the participants for taking 1 hour to join this info session. It's a beautiful day outside, and so thanks for staying with us. So
Yes, thank you so much for
Thank
taking
you.
your lunch hour to learn more about health data analytics, the micro-certificate. So if you do still have questions about the program, please, email info@exl. And I think we shared the program link to where you can register, which hopefully we'll see you at the May start date for the Intro to Big Data. Thank you everyone for joining today, and have a great rest of the afternoon.